how do you know if the McGill Big 3 is going to be right for you? If it's going to be a waste of time, or if the exercises are going to make you worse? In this video, I'm going to share with you a step-by-step process so you can tell immediately by the end of this video, in the moment, if this is something that's going to be helpful for you, the McGill Big 3, if it's going to be something that's going to be a waste of time, or again, if it's something you should avoid. And all of this without having to try it on for days, weeks, or months to kind of just see what happens. So we're going to evaluate the McGill Big 3 exercises in this video and help you identify the one thing that's going to be best for you, if any at all. Hey everyone, this is Dr. Charlie Johnson, physical therapist, and before we jump into evaluating these exercises, if you're interested in determining the most likely source of your back, butt, or sciatica pain at home without needing x-rays, MRIs, or other tests, go ahead, check out my Better Than an MRI DIY diagnostic guide. You can download it above for free. All right, so the McGill Big 3, here they are: the curl up, the side plank, and the bird dog. Something I want to highlight for you, and maybe you never thought this much about it, but this is actually not just 3 exercises. This is at minimum 6 exercises. Now, why do I say that? Well, the curl up can be done on the right and the left side of the body. The side plank can be done on the right and the left side of the body. And the bird dog can be done on the right or left side of the body. And so how do we determine which of these 6 inputs, if any, is going to be helpful for you? Well, we plug it into a process, all right? So the first step of the process that we need to identify via self-assessment, what I call a yucky motion, a motion that increases slightly your symptoms, sort of makes the brakes squeak, increases the symptoms that you experience, so that then we can go ahead, we can plug in these different inputs to find one or none that reduce that or make you feel better immediately in the moment, all right? So first step is self-assessment. We're gonna go ahead and we're gonna test. I'm gonna show you how to do that now. And again, we're trying to find a yucky motion and really objectify what we call like your pain experience. So notice I haven't said anything about a disc problem or piriformis syndrome or sciatica or anything like that. We're not treating the diagnosis. We're instead treating what we're going to call your movement pain relationship. So we can take this medical diagnosis, which exists, on an x-ray or an MRI, which you're probably trying to Google to figure out and is confusing you. And instead, we're going to translate it into a movement diagnosis, something you can see, feel, and understand for yourself. So here's how we go about doing that. So step 1, self-assessment. We're going to bring you through some different movement tests or a self-movement exam so you can identify a yucky motion and find what triggers your symptoms. All right, so here's what it looks like. All right, so there are many different ways to self-evaluate, all right? So I'm going to bring you through a standardized assessment. Just keep in mind, this yucky motion or this thing that increases your symptoms could be anything. It could be, if you know right now as you're watching this, that walking up the stairs increases your symptoms. You could use that as your baseline yucky motion. If you know that bending forward to tie your shoes increases your symptoms. If you know that cutting your toenails is really yucky. If you know that jumping or hopping on one leg is yucky, you could use that as well. So we just need to find something that makes the brakes squeak, something that increases your symptoms ever so slightly so we can go back and try to fix that thing, all right? So if you're not sure, this is what a basic self-assessment would look like, and you could do this at home. So the first step is we're going to go through it. We're going to find something that's a little bit yucky for her, and then we're going to objectify it. We're actually going to put some numbers to it so we can really kind of sink our teeth into it, and then we can look at the numbers to find something that makes the numbers, in this case, go down or get better immediately, all right? So simple movement you can start with is just twisting your trunk to the right. And as you're doing this, you're asking yourself, is that yucky or is it not? So is that a yucky motion? Does it feel yucky? Does it reproduce your symptoms or not? It's yummy. It's a yummy motion. No pain, no problems. Go ahead, twist to the left.
Yummy.
Good. Knee to chest on the left. Good. Knee to chest on the right. You okay with those?
Yep, those are good.
All yummy. By the way, we'll say that she has back and butt pain on the left side just for the sake of the video, okay? So we did twist right, twist left, knee to chest left, knee to chest right. Now go ahead and do figure 4 on the right. We could have done on the left.
Okay.
Figure 4 on the right, good. Yummy or yucky?
Now it's yummy.
Good. Other side?
Yummy.
Yummy, good. Now we'll do leg raises. So go ahead and straighten out your right leg. It might be hard to see, but she's just kicking out or extending her right leg. Go ahead and kick up the left leg. This will often be problematic or yucky if you have some type of sciatic nerve sensitivity. Any yuckiness there?
No.
Good, awesome. All right, and now go ahead and stand on up for me. And just bend straight back for me. So a backwards bend. Any pain or problems?
No, it's okay.
Good, yummy. Twist to the right and bend backwards for me. Yucky or yummy?
No, it's okay.
Good. Twist to the left and bend backwards. She's doing pretty good so far.
That doesn't feel good.
Yucky. Okay, so we found a yucky motion. Ding, ding, ding. That's what we're looking for. And again, it could be anything for you if you're watching this at home. Now, what we need to do is we need to objectify that. All right, so here's what I want you to do now. Once you find a yucky motion, I want you to ask yourself, low, medium, or high? Is it low yucky, medium yucky, or high yucky?
Medium.
Okay. Now, when we think about the scale, so we'll use a 0 to 100 scale, whereby 10, 20, or 30, that's going to be a low yucky. All right, the higher the number, the worse it is. 40, 50, or 60, that's going to be a medium yucky. And then 70 to, we'll say 90, that's going to be a high yucky. So you said it was medium yucky. All right, so the higher the number, the worse it is. Is it a 40, 50, or 60? 50. And by the way, I should have said this in the beginning, but disclaimer, all right? Maybe I'll insert this in the beginning of the video. Disclaimer, if when you're testing your yucky motions, if you find a motion, or maybe a couple motions that are yucky, but it's like a 70, an 80, a 90, something super yucky, and you're worried about flaring yourself up upon retesting, which we'll do here obviously frequently throughout this video, then pick something that's not so yucky. Maybe don't go as far, just the point of where you feel it, or pick something that's a little bit less yucky and is totally testable at least a handful of times as we work throughout this process, all right? All right, so we found that she has a yucky left back bend, and she puts a number to it and scores it. It's a 50 out of 100, medium yuckiness, all right? So now we have what we need to plug in and or try on these different inputs or exercises within the McGill Big 3, which is really 6 different things, through treatment, right? Or through this process. So let's go ahead and show you exactly what you do step by step to identify which one, if any of these, is going to be helpful, all right? So curl up is first up. We've got both the right and the left side. Let's see if this is something that's going to be useful or not. Here's what it would look like. So you've got your yucky motion. Again, it could be anything. You've scored it. So you've got a baseline. We know what we're trying to change. Now, to do the curl up, you're going to lay on your back. Go ahead and just put your hands underneath the sort of hollow or arch of your lower back. And it's recommended that if you have any type of radiating pain going down your leg, that you straighten that leg. So you don't really have any leg pain, so let's just pick one. But if you did, let's just say you had pain radiating down the back of the left leg, you would maybe start with your right leg straight. Here's the thing, it doesn't really matter. That's just sort of how it's taught. All right, so we're gonna start on the right side. Remember, this is curl up on the right, but we could just as well try it on the left side. Now, why would one work and the other wouldn't? I don't know, and I don't really care. The idea is you need to test it. This is the scientific method applied to healing, all right? So to do the curl up, you've got your right leg straight. Go ahead and just lift your head up and just ever so slightly bring your shoulders up. Perfect, just like that. And what we want to do first is we want to have her go through 1 repetition of this motion to sort of try it out. So it's this idea of like, look, if you have a big event or a party coming up and you go into the cupcake store, all right, you don't just say, hey, those look good, just give me all of those, right? You want to make sure the guests are happy and whatnot. So what you do is say, can I sample that? And then if you sample it and it's good, well, we'll go ahead and we'll take those, right? If you sample it and it's not good, then we don't do it. And so we follow a very similar process. So step 1 to the process within actually treating is to try just 1 repetition of, in this case, the curl up with the right leg straight. And immediately, by the way, all right, if it's yucky, we're not doing it. We're gonna say, hey, don't multiply this at home. Don't try this at home, because if it's yucky after 1 rep, the chance that you multiply yuckiness over and over and over again and you get a yummy result, a feel-good result, is not very good. All right, so I'm gonna save you some pain and suffering. If any of these exercises after sampling the 1 rep is yucky, just stop. Just cross it off and know that that's not the best option for you, more likely than not. All right, so you did 1 rep of lifting your head up, right, lifting your shoulder blades slightly off, and was it yummy or was it yucky?
It was yummy.
Okay, so only yummy motions allowed. Again, if it was yucky, we would not do this. We would go to the other side, all right? But in this case, it's yummy, so we know, hey, the guests will probably like this. Hey, your body is probably going to be okay at least trying this. Now, just because a motion is yummy doesn't mean it's going to make you feel better. So now we need to go to the next step where we actually try it on. We take a bigger bite of it, and then we can immediately retest. We're going to retest your yucky motion, all right, to see if it changes it immediately in the now, all right? So go ahead now, and what we'll do is we'll actually do like 3 10-second holds. The McGill exercises are generally done in sort of this pyramid. So you'll do 3 10-second holds. We could do it slightly different, but let's start with that. And I would recommend maybe you do the same at home. You do 3 to 4 10-second holds of the curl up, and we could always change it or build it up later. So go ahead. We'll do a 10-second hold here. You'll feel your neck shaking. You'll feel your belly shaking. It's a little bit of work. We'll just say that was 10 seconds. That was 1 rep. Go ahead again. So now we're actually going through the treatment. Let's just say that was 2 reps, 10-second holds. Hold it, hold it, hold it. A final and third 10-second hold. And now, how do we know if that helped you or not? Number 1, it was yummy, but we want to see it improve what?
Back bend.
Your back bend, your yucky motion. So now we need to go and we need to retest her yucky motion. So she's going to do a back bend left, and it was a 50 out of 100. So is it same, better, or worse?
Same.
So it's a 50 out of 100 still.
Yeah.
All right, got it. So now we don't want to do something that doesn't make any change, right? Some people will argue, well, Charlie, the whole point of the curl up is to increase the stiffness of the abdominal area, to increase the core stability, some might say. And that's not going to happen immediately in the moment. And while you may be correct, what I would say is that if we don't see a change immediately in the moment, then what evidence do we have to support the idea that someday, in some way, in some shape, somehow, it'll make her better? So my question to you as the patient, right, is would you rather do something that makes you better immediately in the moment? Would you rather do something that makes no difference? Or would you rather do something that makes you worse?
Better.
Better.
Yeah.
Awesome. Okay, so we want to see an immediate change, because if I don't see an immediate change while you're doing these exercises, I have no evidence or reason to believe that it will somehow help you in the future. Is that fair?
Yes.
Okay, great. All right, so it made her the same. So now what you do if an exercise makes you the same, in this case, the curl up with the right leg straight, is you tweak it. All right, now McGill doesn't talk about this, but I've just found that sometimes people respond to exercises if they do them slightly different. So we're not really changing the exercise per se. We're not moving from the curl up to the side plank. Instead of doing holds with the curl up, the tweak is going to be reps. So for the sake of this video, you could do holds with a curl up, or you could do reps. Or with some of the others, it could be vice versa. You could do reps, and if reps don't work, the tweak could be holds. All right, so we're going to try it slightly different and just see what happens. So now, go ahead and do reps for me. So maybe do 3 sets of 10 reps. Go ahead. 1, 2, 3, and we'll say that's 10. All right, good. Little break, right? Go ahead again. And look, if you can't do 10, maybe do 3 times till your belly's a little tired. So if that's 8, if that's 12, right? Just get a little bit of a workout. Good. And notice we're not changing a lot of the spinal position, which is why you have the hands underneath here. We're just lifting the shoulder blades ever so slightly off the table, all right? So we did 3 sets of 10 reps. We know she didn't respond to holds, but maybe reps will help. Why? Again, I don't know. Sometimes people respond to reps versus holds for whatever reason, okay? So now what are we going to do?
Retest.
We're going to retest, and what are we going to retest?
My back bend.
Your back bend. Go ahead, your back bend left. It was a 50 after the holds.
Worse.
Worse, woo! So do you want to do something that makes you feel worse immediately in the moment?
No.
But I was told that if I just do something that makes me feel worse, maybe it'll get better eventually.
No.
That sounds like a bad idea?
Yeah.
Bad idea. Don't do that, okay? This no pain, no gain doesn't generally turn out very well for people, all right? So I know a lot of people are like, well, I was told to do this exercise, I have a disc problem, and maybe it's supposed to get worse before it gets better. Don't buy into that, all right? All right, so what do we do now? So the holds didn't work for her with the right leg straight, the curl up. The reps made her worse, so we're going to stop that, right? So to be clear, I'm going to come back here. All right, so self-assessment, treat, right? And then we went through, we just showed you this retest process. And there's only 3 outcomes from any given input or exercise in this case. 1, it could make you worse, right? In which case, that just made her worse. And by the way, what do? You stop that. It could make you the same. It could cause no change, in which case, we try to tweak it. We try to go from holds to reps or reps to hold. We try it in a slightly different way. Or it can make you feel better. If any of these at any given time, you find that it makes you better, then stop. You do not need to do the rest of the McGill Big 3. You've proven that one of these elements within these 6 different things is valuable for you because it made an immediate improvement in not your diagnosis or anything like that, but your yucky motion. It's a yummy, safe motion mentally and physically for your body. And number 2, it immediately improves how yucky you feel, meaning it makes you feel less yucky. It improves your movement experience. That's all we're looking for. And we find that through a test, treat, retest process. All right. So in her case, the holds didn't work. The reps made her worse. The curl up on the right is not for her. So now what we would do is we would apply the same process, except her left leg would be straight. All right. So she would do the curl up with her left leg straight. You'd apply the same process. You would do 1 rep of the curl up with the left leg straight. And if it was yucky, cross it off. If it was yummy, then you would go ahead and you would do 3 10-second holds. And then what would you do? You would retest and follow the logic. If it made you worse, you stop. If it made you the same, you would go to reps. And if it made you better, you're done. You would stop. You would take that left curl up home with you. And we'll talk about here at the end of the video, you would use it as medicine. So stick around to the end of the video to better understand what I'm talking about with regards to using movement as medicine and finding your optimal movement prescription. All right. But let's just say at the curl up left, it didn't do anything either. All right. So now we're on to the side plank. And again, we've got 2 options to the side plank. Working the right one only could help you out, and working the left one could make you worse. So we've got to test them out individually. All right, so let's go ahead and let's do the left side plank first, just because she's facing the camera. All right, but let's test out that individual variable and see if it's going to help her out. All right, so go ahead and lay on your left side for me. Perfect, knees together, feet back just a little bit. All right, stay completely on your side, and go ahead and take your right arm and put it on your left shoulder. Perfect. Now you got to get up on your elbow a little bit though, okay? Perfect, yep, and up on the shoulder. You got that? Okay, so go ahead now, a little bit of tightness in the belly. Go ahead, lift it on up, and then move forward with your trunk so that your knees, your hips, and your shoulders in line. You got it? Go ahead and give me just 1 rep and let it down. Just want to make sure, remember that's step 1. Just try it on, take a lick of it. Yucky or yummy?
Yummy.
Awesome. So it's a possibility, but we don't know if it's going to improve her back bend. Remember her yucky motion, her left back bend. And you won't know if it's going to improve your yucky motion either until proven that it works, all right, until testing it. All right, so now we know it's safe. Great. Now go ahead, Heather, and side plank up for me. So a little tightness, bring it up, pull it forward, knees, hips, shoulders in alignment. 3 10-second holds. Now we're in the treatment phase of things. That's 1, let's just say 10-second hold. We'll call that 2. And let's just say she held it for 3 rounds of 10 seconds, all right? Now, how will we know if it's going to work for you?
Retest.
We retest. You see the process. I'm showing you the process here, and then you can apply this to anything. So go ahead, stand on up, and it was your left back bend that was a 50. Okay, so it's the same, right? And look, we're not splitting hairs here, all right? It should be clearly better. If you have to do it 5 times to determine if it's any better, guess what? It's not any better. If you need to, open your eyes 5 times in the morning to see if the sun came up, it probably didn't come up, all right? And so we want to make this very clear. Don't split hairs, either same, better, or worse, all right? So that didn't work. It made her the same, all right? So what do? If something's the same, we tweak it, and we just tried hold. So what's another way that we could try it?
Reps.
We could do reps. Now again, McGill doesn't really suggest this, but I'm just helping you see that maybe there's some hidden value within these exercises that you haven't discovered. And I'm just showing you a way to highlight it, okay, and pull it out. So go ahead, a little tightness there in your belly, lift it up, and pull your hips forward so everything's in line. Hold it. Oops, don't hold it. Do reps.
Reps.
All right. 3 sets of, let's just say 10 reps or until you're tired. That's right, we switched to reps. 1 set.
Okay,
2 sets. Now, Charlie, what about her form? Is she doing this right? Is she doing this wrong? Contrary to popular belief, there is no right or wrong way to do this. She's just moving her body. She did holds, and then she's doing reps. You do okay?
Yeah.
All right, cool. So now she did reps. Will reps help her? I don't know. Let's see. How will we know?
Retest.
Retest. 1 time your yucky motion.
It's worse.
Worse. Worse. Okay. Now, so if something's worse, you stop. And by the way, I should have said this in the beginning, but disclaimer, all right? Maybe I'll insert this in the beginning of the video. Disclaimer, if when you're testing your yucky motions, if you find a motion, or maybe a couple motions that are yucky, but it's like a 70, an 80, a 90, something super yucky, and you're worried about flaring yourself up upon retesting, which we'll do here obviously frequently throughout this video, then pick something that's not so yucky. Maybe don't go as far, just the point of where you feel it, or pick something that's a little bit less yucky and is totally testable at least a handful of times as we work throughout this process, all right? So that one made her worse, okay? So guess what? The left side plank, both holds and reps, she did hold, she tweaked it. The reps, she did that, and they didn't work. They either made her the same or they made her worse. So we don't do that, and you don't do that either if that's what you find. So now we would do what? What will we do next?
Move to the right side.
Move to the right. Move to the other side. Well, Charlie, the left side didn't help me, so why would the right side help me? I don't know, and I don't care. Neither should you. We're not treating the diagnosis. We're treating the input. All of these things are inputs. A, B, C, D, E, and F, all right? And we're testing them out to find those that are safe and those that make an immediate change. So you would move to the right side plank. You would do what? First things first. You would do what?
Test it one time.
Test it one time. Take a lick. All right? If it's yucky, what do?
Move on.
Move on. Move to the next one. In this case, the bird dog. All right? If it's yummy, what do?
3 sets of holds.
3 sets of 10-ish second holds on the right side. All right? And then you would follow some rules. If it made you better, you'd be done. All right? No need to continue with this video or this process. Let me know what you found in the comments below. All right? If it's the same, what would you do?
Tweak it.
Tweak it. You'd go to reps on the right side in this case, side plank, right? And if it made you worse, you would stop immediately and you would go to the next one, all right? The bird dog, all right? Test, treat, retest, follow the rules. Test, treat, retest, follow the rules. That's how you determine if a treatment is going to be valuable immediately in the moment. This is applied to McGill Big 3, which is really the big 6, all right? And we don't want to do 6 things, by the way, at one time because you'll never know what's working. That's the value in the video. So bird dog, that is the last one. And we've got the right and the left side. So let's go ahead and let's see if that's something that's going to be helpful for you. All right, so go ahead. Bird dog, hands and knees. All right. And the neutral position of the spine is not neutral, not flat backed. It's not all the way humped up. Go ahead and hump it up. Yep. And it's not all the way dropped down. All right, it's just slight extension of the spine according to McGill, all right? Again, find whatever's comfy, but neutral spine, all right? As per sort of the instructions, all right? So now, for what we're gonna call the right side, we're gonna label this and make this up. You're gonna kick the right leg out and the left arm up, all right? And go ahead, try it once. That's the first step, right? Okay. Now, is that yummy or yucky?
Yucky.
Yucky, ugh. So if something's yucky, what do?
Move on.
Move on, because if doing it once is yucky, do you think that doing it over and over again is likely to make it feel better?
No.
No, all right? And so again, not the no pain, no gain approach, all right? So we kicked out the right leg and the left arm, it was yucky, all right? We cross it off. It is not an option, all right? Made her worse after 1 rep. All right, so now we go to the other side. We've got the left leg. We're going to call this the left leg and the right arm, the left side. You try it on, just, a couple second holds or just 1 rep there, and we want to see yucky or yummy.
That's yummy.
Yummy. So again, it's an option, but let's see if it works for her. Let's go through the process. So go ahead, kick that out, arm up, hold it, 10-second hold 3 times. If you notice that as you do this, it's hard to kind of stay stable, right, then that's good. It's a challenge, right? But you could also put like a little ball on the back or even like a foam roller. You could have somebody sit something on the back. So this way you can kind of make sure that it's level and it doesn't fall off, all right? Just a little bit of a cue there, all right? So she did 1, she did 2. Let's just say that was 3 10-second holds. Is it going to work for her? How do we know?
Retest.
You retest. So do 1 rep of your yucky motion, whatever that is as you're watching this. And that was a 60 or something like that.
Same.
Same, okay. So what do we do now? It's the same.
Reps.
Reps. Cool. We tweak it. Perfect. She followed the rules. Test, treat, retest, no better. Tweak it. Go from holds to reps. So let's just make sure, for whatever reason, her body doesn't have some preference for reps and whatever those reps are doing compared to the holds. All right, so go ahead now. Let's do, say, 3 sets of 10 repetitions this time. 1, 2, and again, notice there's not excessive motion of the spine. If I sit my marker on there, yeah, that would be, I don't want to say no bueno, but that would be something that would be frowned upon by a lot of people, all right? And so I would just say, for the sake of this, you kind of do it as prescribed. You keep this neutral spine, right? Again, I put a marker on her back, and she just works the exercise in a repetitious way, all right? So 3 sets of 10 reps. I know she didn't do all of them. She's cheating and trying to get by. But the idea is, let's just pretend that that happened, and now we see what the body thinks of that. So we go ahead and we retest 1 rep of your yucky motion.
Better.
Better. Ding, ding, ding. There we go. Really cool. Okay, so now would you rather do something that makes you better immediately in the moment, something that makes you feel the same, or something that makes you worse?
Better.
Awesome. And all these things, right? So we did the curl up on the right side and the left side. We went through the process there. We did the side plank on the right side and the left side. Then we went through the bird dog. I can't even remember the side that just made you better. But we did one, and then we did the other, and we found that holds didn't work, but reps made you feel better. So of all of those motions, this is the last part kind of the process, if you will, bring it full circle. You would go home and you would do the thing that made you immediately better in the moment. Now, here's the deal. Just because something, one of these 6 inputs, or here's the deal, maybe even multiple of these inputs can make you feel better, but there's more than one way to skin a cat. So we could send you home with a bunch of them, but then the problem is that we'd be mixing a bunch of things and we wouldn't be sure what was actually working. So that's not very scientific. And so what I'd ask is you go home with the one that made you feel better. Why do I say one? You shouldn't even find multiple that make you better, because you stop as soon as you find one that makes you better. So if you're trying to josh the process and being like, well, maybe there's something else, right? Stop it, all right? And so now we bottle up that motion. We say, all right, that bird dog on that, whatever side it was, what side was it?
It was my right leg.
All right, your right leg, all right? What worked? Reps, 3 sets of 10 reps, bird dog on the right leg back, the left arm up, and we could use that as medicine. And so what we could do is we could take that movement and bottle it up and give it a specific movement prescription. So you have your prescription, you just came to the pharmacy, I just handed you a bag that says bird dog, right leg back, left arm. I'm so confused about which one it is, even though we say it over and over again. And now we want to know, what does it say about the prescription? What do I mean by that, right? So any given prescription, any pill that you take for a backache or a headache or maybe for some other reason, has a specific, so here's the pill bottle. Instead of it saying, for headaches, all right, now it's going to say the bird dog, right, on the one side, all right, so the right side, the right leg back, the left arm forward, all right? And within that, any given medicine or prescription has a dose, a frequency, and a timing. So the dose is how much you do, the frequency is how often you do it, and the timing is when you do it. So now we take the one element upon testing, treating, retesting within the McGill Big 3, McGill Big 6, right, that actually works for you, if any. And by the way, if all these made you worse or made no change, don't waste your time. It's not going to work, all right? So dose would be, what did we say? We said 10 reps, because the reps worked, the holds didn't. 3 sets. Now frequency, a generic prescription might be, hey, we do this 2 times, maybe 3 times a day to start, all right? And the timing, when do we do it? This is sort of, this is next level thinking, all right? So most people, when they get exercises, they just do them whenever is convenient, right? But if you think about it, you don't take pills when they're convenient because they're always convenient, right? You can just pop a pill wherever you are and it's no big deal. But exercise is a little bit different. But ideally, we try to time it when it makes most sense. So if you had a headache, right, at 5 p.m. in the evening, when would you take the headache pill? You'd probably take it at 4:45, 5 o'clock, something like that. If you had a headache at 7 in the morning, right after you wake up, you would probably take it right in bed, right? You'd have it on your nightstand, you would take it then. The same thing goes for movement. If movement is medicine, then the timing of it and the dose of it and the frequency of it matters. So instead of just doing exercises first thing in the morning when your pain is worse at night, it doesn't really make a lot of sense. Instead, try to shift these 2 to 3 sets towards the afternoon time. Or if symptoms are worse right when you get out of bed, roll on over and do the bird dog or whatever it was that you found right there in bed. All right, to take it as a pill and to make yourself feel better. So we find through this process the one thing that makes you feel better. We stop the process, we pull that out, we bottle it up, we hand you a bag. That exercise or that pill is on the front. We look at then applying a prescription, a dose, frequency, and timing. When you do it, morning, night, maybe it doesn't matter. Maybe we start just kind of generally because your symptoms are just kind of consistently there. And then what we do is we try that motion on for 4 to 7 days. Just that one, all right? You're just one motion away, if you will. Just that one pill. Now, a lot of people will argue with me and they'll say, well, Dr. Charlie, how is it possible? I don't believe that just one of these motions, right, could solve my problem. It's called the McGill Big 3 because that guy's really smart and all three of these things together probably has some value. Well, maybe it does. We'd have to test it, right? But at the end of the day, why do more? Why would you take more pills than necessary? The goal is always to take as much as needed, as little as necessary, right? And so for the next 4 to 7 days, if you believe that a headache pill or one pill could reduce your headache or your aches and pains in your body, one motion could potentially do that too. And so you're going to take that one pill according to the prescription, dose, frequency, and timing for the next 4 to 7 days. And then what we can do is we can go back and we can look at the overall big picture. Is your yucky motion still becoming less yucky, more yummy, if you will? Is it not a 50 or a 60 and now next week it's a 20, it's a 10, right? Is your ability to get up and move around, to walk, to bend, to lift, to do any of the triggers or things that aggravate your problem, are those things getting better as well? And so then we can step back, look at the big picture, and really see if this movement is something that's helping you out long term, all right? So movement is medicine. If at any point, by the way, the motion that makes you feel good in the moment within this video proves to become yucky later on, just stop it. There's other things, there's many other variables that we can discuss besides these motions here on the board, and I'd be happy to help you test those out if you're interested. That being said, try it on. Do not retest your yucky motion, every single day or after you do these things to see, oh, is it better, right? Just literally take the pill, all right? And so that's that, all right? So again, the value of this video is to help you start testing and not guessing. And instead of just blindly trying the McGill Big 3 for weeks or for months, hoping that it eventually works, the truth is that it's really 6 different inputs. And if you have a process for testing, instead of treating your diagnosis, testing and finding a movement that increases your symptoms, boom, right now, and you can objectify it with a certain number, low yucky, medium yucky, high yucky, then we can go through testing and plugging in those different inputs to find something that is going to make you better immediately in the moment, what gives us proof and or evidence to believe that it potentially will work in the future. Just because a light bulb works now doesn't mean it's going to work in the future. It may work. You may find that after a week of doing it, 4 to 7 days, that you're no better, in which case that's okay, right? But the chances of making yourself worse doing a safe, yummy motion is very low. And so we can go through this process, then we can bottle up anything we do find that makes you feel better. We can apply a movement prescription, the dose, frequency, and timing to it, and we can try that on and then step back big picture to see if it's helping us or not, all right? So hopefully that was helpful, and hopefully it saves you a ton of time and energy and probably money as well, because you can test these things as long as you're aware of the process, right? And you can know now, not later, if it's something that's gonna help you out, all right? So again, this is Dr. Charlie Johnson, physical therapist. If you're interested in potentially working with myself, because we can show you a process, we have a system, we only work with people with back, butt, and sciatic problems all around the world, and I wanna teach you how to use the power of your mind and movement, as you can see, as medicine to solve the issue. If you're interested in that, go ahead, click the link below. It'll take you to a separate page where you can set up a time to chat with us. And also, I will review your case personally. So then follow instructions to submit what I call a case review, and I'll check it out personally. If I feel I can help, I'll let you know. If I feel I can't, I'll let you know as well. So thanks so much. Let me know your thoughts below.